And so with that, I think it's interesting to then talk about two other BTK inhibitors and long-term data that was presented for first Acalabrutinib. So Acalabrutinib is approved for use in relapsed refractory mantle cell lymphoma. That initial approval was based on a median follow-up of about 15 months from a phase 2 clinical trial, and at this meeting there is now a report of 24-month follow-up data, and essentially what I think is an important takeaway from that abstract is that overall the response rate at 24 months is quite comparable to what was reported earlier. So more than 80% of the patients had a response to therapy, with a similar proportion of patients having complete responses and partial responses. So about half the patients had a complete response, about half of the responders had a partial response, and that was true at the 24-month follow-up period. And then I think also importantly, the toxicity data. So much of what was described in the early, from the early follow-up in the clinical trial seemed to be true in the long-term follow-up. So there didn't really appear to be a clear emergence of any late toxicities, which is important. And most of the patients were able to continue to stay on therapy at the 24-month follow-up. So I think those are two important findings, especially when thinking about long-term follow-up from these kinds of trials.